Hello, this is Dr. Shevin speaking. What we're going to discuss now is when is an earache not an earache. The ear, in fact, has a supply from 4 different cranial nerves. In other words, nerves that supply the ear. And those are the 5th, the 7th, the 9th, the 10th cranial nerves. And what that means is that any of these nerves can transmit the pain fibers to the brain. Your brain doesn't know which, in fact, that source is. All of them have in common that they all supply the ear. And therefore, even though they supply the ear, the source may not be coming from the ear, but from one of the other sites supplied by those nerves. And what are they? So first of all, the tongue. Both the oral tongue and the base of the tongue can cause ear pain if there is a process involving those sites. For instance, aphthostomatitis or mouth sores that can appear anywhere on the tongue. When you have it, that can actually represent itself as ear pain. Tumors of the tongue will also present oftentimes as ear pain. That's the first symptom the person may in fact have. Another area that refers to the tonsil refers to the ear is the tonsils. The tonsils, as you can see over here, are situated on the side of the throat. Those are the tonsils, one of the 4 areas of tonsils that we have. And those can refer pain to the ear. So if you have tonsillitis, one of the symptoms is having ear pain. If you have a peritonsillar infection or quinsy, that can also refer to the ear. Another area that refers to the ear commonly is the temporomandibular joint, commonly known as TMJ. This is the joint. Now if you'll notice, that joint is directly in front of the ear. And therefore, even though the source of the pain is the joint, just like any other joint, like you have a knee pain, it's actually, the source of the pain is the joint, not the ear itself. Another area is the thyroid. Some patients can have thyroiditis or inflammation of the thyroid, and that pain from the thyroid will in fact refer from the thyroid all the way up to their ear. That might be their presenting symptom. A large area that can refer to ear pain is anything in the throat area. For instance, if you have an infection of the epiglottis, the upper part of the voice box, or the voice box itself, or the throat on either side, that can manifest itself as pain radiating to the ear. So the throat is a very big site which refers there. Another common area is the teeth. Issues with your teeth, particularly the molar teeth, can present as ear pain. Again, it's not the ear that's the source, it's the tooth, but it refers the pain to the ear. Another area is the nose, the nasal turbinates. Okay? Issues with the nasal turbinates such as inflammation or polyps or infection can refer that pain to the ear. Another site that we deal with commonly is the nasopharynx. That's this portion over here. And those infections or even reflux that hits this area or tumors in this area can refer the pain to the ear. The palate, this is this portion over here, can refer pain to the ear as well. Issues with the palate can also be a tumor or aphthostomatitis or inflammation of that sort. And finally, the parotid gland, which is one of the salivary glands situated right over here, or the submandibular gland, may refer pain to the ear. The takeaway point is that ear pain may not be sourced in the ear, but somewhere else, and then referred to the ear. Thank you very much for your attention. If you have any further questions, you can call our office at 212-472-8882. Please visit our website, NewYorkHeadAndNeckSurgery.com. That's NYHEADANDNECKSURGERY.com. Thank you very much. Have a great day.